Okay.
My name is Chopra, and I am an acupuncturist.
And tell me how acupuncture works. How does it, how did putting needles in your body, how does that affect you?
Okay. Well, from a traditional Chinese medicine point of view, how acupuncture works is that it's helping to adjust the flow of energy in the body. So just like we have nerves in our body, a network of nerves, a network of blood vessels, there are a network of channels through which energy flows in the body in certain directions, in certain rate and speed. There's a certain quality to the flow of energy. So by stimulating key points, which are places where energy comes together, you could think like kind of like intersections of a lot of energy concentrated at those points. You can redirect flow of energy at those particular points using pressure or using a needle, which is quite potent. So that's sort of a very general, basic way of how acupuncture works, helping to rebalance and adjust the flow of energy in the body so that it's working more optimally for the person.
So theoretically, how could acupuncture help with cancer?
Well, so first just to say,
I mean, in terms of Chinese medicine, how does?
Yeah. So, just to backtrack for a second to say acupuncture is always, in Chinese medicine, we're always looking at the person and treating the person and not the disease. So from that point of view, like any person with whatever processes are happening in their body can come to acupuncture and receive a diagnosis and assessment and be treated to help balance energy in their body. So cancer, for example, is, as I'm sure people know, right, abnormal cells growing at a very rapid pace. And so from a Chinese medicine point of view, what we would do is help to stimulate the immune system. That's one of the effects that acupuncture has. And help the body to do its job better. On a sort of fundamental level, it's helping the body to do its job of maintaining homeostasis better. And so when a person has cancer, when like the person's body has, for whatever reason, has stopped being able to do the job that it's supposed to do, which is that, if there's an abnormal cell, it dies and, new healthy cells are born. So acupuncture, one of the major ways that it helps is by supporting the person's immune system to do the job that it's supposed to be doing better.
So, yeah, how does the treatment work? Like a acupuncture treatment, what happens when someone comes in, or?
Sure. So first, it's just getting a history, so asking lots of questions, getting an understanding of what's happening in this person's life. Yes, their medical, sort of physical health history, also just getting a sense of their lifestyle, their emotional health history as well. And then we have some methods used to assess. One is looking at the tongue, so tongue diagnosis, and another is checking the pulses at the radial artery. Sometimes we also palpate the abdomen. There are certain qualities that we're feeling for that's giving us information about processes happening in the person. We're also looking at the person, their color, and then we're also pressing points along the channels of the body, and that too gives us information. So the first step is really coming to an assessment. When someone comes, find out why are they coming, what are their goals, and then using these diagnostic tools, just like a medical doctor may order blood work, we are going to look at your tongue instead. We are going to check your pulses. And then from there, the acupuncturist comes to a working diagnosis and chooses meridians or channels that are in need of support and either to be tonified or dispersed, either to be strengthened or if there's stagnation to help to disperse the energy there. And then those points are chosen and the person has needles inserted at those points on the body, and it could be just 4 points, it could be 30 points, it really just depends. And then once the needles are all in, the person might lay there with the needles for anywhere, again, it could be 10 minutes, it could be 45 minutes, resting with the needles, letting them do their work, and then the needles are taken out and
So someone comes and they undress, so they lie down,
yeah.
and does it hurt? I mean, that's a big thing. The word needle is so scary.
Well, first, just to say, usually in a private practice, people are laying on a treatment table. Sometimes they can just stay dressed and they just pull up their pants, and many points are from the knee down and from the elbow down and on the face. So sometimes you don't have to undress, sometimes you do, it just really depends. And then does it hurt? Yes, this is such a good question. My quick answer to that is no. But the thing I want to also say is it's not necessarily that you don't feel anything. So there are different styles and approaches within acupuncture. There are many. So there are some styles where the technique of inserting the needles is very light and the thinnest needles are used. There's Japanese style acupuncture that's like that. There's another style of acupuncture where it is important that the person actually feels sensation at the point. We call that, there's a term de qi, it's just obtaining the qi or the energy at that point. And there, usually what people describe is like a little ache or a tingling sensation or a feeling of warmth. Sometimes if a point is put, say, by the elbow, someone might say, oh, I feel that in my middle finger. Feel it at a different location. Oh, that went all the way down the leg. More, so there is sensation involved. I personally do like people to get in touch with and feel what's happening in their body, and that's one of the other things that acupuncture does is just bring people to tune in to sensations in their body. But as far as does it hurt, like people think needles, it's nothing like a hypodermic needle, it's nothing like the needle used to draw blood or to give you an injection. Maybe you would need many acupuncture needles to equal the width of one of those.
So it's not really scary.
No, it's really not at all. And I've treated people who have needle phobias, and they just want to close their eyes and it's fine because they're not even realized, you don't feel it as if you're having needles poked in.
And how long does each treatment take? How much time should someone put aside for a treatment?
Again, it varies per practitioner, but I would say like an hour is pretty average. Some people, it could be a little less, sometimes a little more, somewhere between 40 minutes to an hour and 20 minutes maybe, but an hour is pretty average.
And are there certain kinds of people who, personality types or things that respond best to acupuncture?
That's such a good question. It varies a lot. I will say that I have just, in my experience, yes, have found that there are people who are more like responders to acupuncture, and then there are those responders generally respond for many things, whether they have shoulder pain, a yeast infection, digestive distress, like their body seems to understand acupuncture and respond well to it, and then others might have a more challenging time. But then I've been surprised where there's been someone who to me might fit a type I might have had in my head and said, I don't know if they'll respond so well. They're really wound up, and they actually respond pretty well. So it varies a lot. I mean, one, I would say it always helps if someone is open, but again, people have come. I don't believe this at all. My wife told me to come, and then, no, I guess or they fall asleep in the treatment. That's weird. I can never sleep in the daytime. So I feel like everyone, it's worthwhile to try not to self-select a person out beforehand, because you really never know. I thought I had an idea in mind of those who would be more responders, and I used to think it had a little bit something to do with the nervous system, if someone's nervous system was so wound up they couldn't relax. But what I found is that the acupuncture in so many cases actually is the very thing that person needs to help their body to switch, to get chemicals released that are actually allowing the parasympathetic nervous system to kick in. So
do you feel like, and again this is theoretical, but in terms of Chinese medicine, are there certain kinds of cancers that respond better to acupuncture?